Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and healthcare professionals discussing health topics of importance to local residents. Today, we are here at the new Novant Health South Brunswick Medical Plaza in Carolina Shores. We'll have the opportunity to tour the imaging suite as well as the family and internal medicine clinics. We'll also meet several of the primary care and specialty providers offering services at this location. So let's get started. Let's take a look at the new Novant Health South Brunswick Imaging Center with Supervisor Tara Mansour. Hi Tara, thanks for taking time out of your busy day today to show us around your new place. We're really excited to see it.
We're excited to have you here.
Well, let's tell our viewers where you're located now. It's in a new area.
Yes, we're on the corner of Persimmon and 17 North.
Great, and it should be easy to find. I think it's near Crow Creek. It's like right down
It's right past Crow Creek and actually the farm, the home development right there.
That's great. Well, perfect. And thank you so much for that. I know our viewers who haven't met you before would love to hear about your position here at Novant Health. So tell me what you do.
Okay, I've been here with Novant Health for about 8 years. I have been the supervisor of the radiology department for the last 3 years.
Well, that's wonderful. Tell me a little bit about the services that you're going to offer here at this location.
Right now, 5 days a week, Monday through Friday, we're going to offer ultrasound and also general x-ray. And then come May, hopefully, we will have MRI once a week. It'll be a mobile MRI van that will come to the facility. And also once a month, 1 day a month, we will have mobile mammography.
Oh, that's awesome. That is great. I know your viewers, I know the viewers really want to see the office, so tell us a little bit more about what we're seeing here when the patients arrive and what will be their first experience.
Okay, they'll come into the front door. This is our waiting area. Mm-hmm. We'll have a greeter that's going to be sitting at the desk where you'll register for your exam that you're coming for the facility to do. Mm-hmm.
So we're going to ultrasound, is that correct? Okay, tell me about ultrasound and what happens in ultrasound.
Okay, this is our ultrasound room. Basically, we just do general ultrasound here, and it's just the basics. We won't do any invasive procedures at this facility. Mm-hmm.
Do all the services offered here, do they require a physician referral order?
They do. The only thing that will not require a physician's order is going to be the screening mammograms, and that's the mobile. This is just where we do the general x-ray. We'll do your chest x-rays and spine x-rays, things like that.
And is this equipment all new?
This is all very new equipment. So Novant Health really stepped up and gave us what we really needed for the community.
That's great. This is a beautiful suite. There's plenty of room. And,
yes, there is.
I'm really surprised at the size of it. You know, usually at the hospital they're so big.
Yeah.
You see so much equipment, and I was concerned about how they would fit all that equipment in here, but this is great.
No, they did a very good job of putting everything in here, giving us plenty of space.
Give me some ideas of when an x-ray might be necessary.
Let's just say that a patient comes in with a cough. They can come in either next door, let's just say, and one of our physicians will write an order for a chest x-ray. So they'd come in here, we'd do a quick 2-view chest x-ray, and it'd be in our system, and the physician would be able to have it hopefully within the hour.
Well, what about other reasons why you might need an x-ray, like for a broken bone or something
Oh, absolutely.
like that?
And lower back pain. We do a lot of spine work, and like you said, any fractures or things like that.
So you could do all of that here?
Absolutely.
And the physician office being on the premises here, makes it easier to get reports and
And
what
it's
have
very
you.
convenient for the patient as well. So the patient is, I mean, well taken care of, just going from one place to the next.
And with the ultrasound, then the OB patients may need that also. So that's
Absolutely.
convenient. It's right here. Great, great. Now, I believe you said that you will offer mobile MRI and mobile mammography. Are there specific days set aside for that?
Right now, if we do the mobile MRI, it's going to be on Wednesdays, and then on Thursdays for the mobile mammo.
Yes, and that's a great thing for women in Brunswick County because this is kind of a rural area.
Absolutely.
And it's hard to get to the facility, so they can stop by on a Wednesday and have their mammo.
Thursday.
Or Thursday.
Yeah.
Good. Wednesday's MRI, Thursday is mobile mammo.
Correct.
Well, what a great service for our community. I think that it's just a great thing for Brunswick County to have this here.
Absolutely.
Is there anything else that you would like to share with us before we wrap up?
No, I did want to say that if you wanted to know any more information, feel free to call this facility. You can call 910-721-4190.
Great. Well, thank you so much for your
Thank
hospitality
you.
today. We appreciate you showing us around, and we'll check back in with you in a few months and see how you're doing.
Sounds good. Thank you.
Dr. Tillison, thank you so much for taking time out of your busy day to be with us today.
Oh, it's my pleasure to be here. It's an exciting time down here now.
It is a very exciting time, and I know that lots of our viewers out there know who you are, but let's remind those who may not have seen the past shows with you.
Oh, sure, yeah. I'm a general and vascular surgeon and do surgery in the Brunswick County area.
Well, great. Let's talk a little bit about your practice. It's Novant Health Surgical Associates, correct?
Right. There's 4 of us in there. We're all board certified surgeons, and we do a variety of things.
Right.
All kinds of general surgery, and sometimes people don't know what that is, but it covers everything from thyroid surgery, breast surgery, any kind of abdominal cancer surgery. We also do vascular surgery, endoscopy, minimally invasive surgery, laparoscopic surgery.
Wow, that's a lot.
Yes.
That's why it's called general, right?
Yes.
Now, I understand you've recently added this Carolina Shores location as well. Now, will you be seeing patients here?
Yes, I'll be seeing patients down here every week, and also my partner, Dr. DeSandre, will also be seeing patients down here.
Great. Well, what kind of services are you going to offer here?
Well, this is really nice because we're connected to a large office with a primary care base.
Right.
It's going to have at least 5 primary care providers in there, which will allow people to come to see their regular doctors here, and we'll be right next door. Besides ourselves, we're going to have urologists down here, we're going to have OBGYN doctors down here, and then currently we have full basic radiology and ultrasound.
Yes.
Once a week we're going to have MRI, and we're also going to have mobile mammo. As you know, you helped spearhead that for us.
That's correct. I'm excited about that. Excited to bring that service to the southern end of Brunswick County. Now, I know you do a large variety of surgeries. Tell us a little bit about some of the specialties that you do perform.
Sure. We do all kinds of surgeries for reflux disease. So we do things that, if you look them up, they're called Heller myotomies. This is a new thing that we've been doing. Dr. Beninati brought it down here. Nissen reflux surgery. We also, all this is done through a minimally invasive approach. Most people stay one day and go home the next day. A lot of people don't realize it, but acid reflux and GI problems are probably one of the #1 or #2 cause of people needing to take medications.
Wow.
So this has been very, very helpful. And also we do a variety of advanced cancer surgeries.
I was curious about that.
Yeah, we do a lot of thyroid cancers, a lot of breast cancer, and we do breast cancer reconstruction.
Wow.
Yeah, we have a very good plastic surgeon for that down here also with us. And then we see a lot of colon cancers and other type of cancers also.
What about minimally invasive surgical procedures?
Yeah.
You do offer those, correct?
We do. Most of the time we try to approach things that way. Even some of the larger cancers, we will do that also.
Now, I know you're on staff at Novant Health Brunswick Medical Center. Is that correct?
Yes, that's correct.
And will other patients need a referral to see you?
Sometimes some will, but most of the time they won't. It'll
they
usually
can-
depend on their insurance, but if they have any questions, they can just call us directly
That'd be great.
at 910-721-4000,
Mm-hmm.
and we'll help them get any referrals that they need.
I know they're happy to have you down here in the southern end of the county, and we appreciate you being on the show today and look forward to seeing you soon.
Thank you. It's exciting to be down here in the new building with other colleagues.
Dr. Bodenheimer and Dr. Thompson, thanks so much for joining us again today.
Absolutely, happy to be here.
Good. I know some of our viewers have already seen you on our show, but for those who may have missed it, let's reintroduce yourselves and tell us a little bit about what you do.
Absolutely. My name is Nick Bodenheimer. I'm originally from High Point, North Carolina. I went to medical school at Virginia College of Osteopathic Medicine in Blacksburg, Virginia. I finished residency at New Hanover Medical Center in Wilmington last year, and so I recently joined the practice.
Great, great. How about you, Dr. Thompson?
My name is Richard Thompson. We have pretty astonishingly similar backgrounds. I'm from Virginia. I also went to Virginia College of Osteopathic Medicine and finished residency at New Hanover Regional Medical Center. And I've been with the practice for a little over a year and a half now.
Speaking of the practice, tell me a little bit about the practice. How many providers do you have in the practice now?
Right now we have myself, Dr. Thompson, Dr. Shue, Dr. Toller, and Dr. McCarthy. We also have Sarah Brown, who's a nurse practitioner who is wonderful.
She is wonderful. We've had her on the show
Absolutely.
before. Yeah, patients
Yeah,
love
she's
her.
great.
Well, now, I know you've recently added the Carolina Shores location to your practice. Will both of you be seeing patients here?
Yes, for sure.
That's great. I know they're going to be glad to have you in the southern end of the county. It will be more convenient for folks who live down this way.
Absolutely, we're happy to be here to help out.
Yeah. Are there others in your group who will be here?
Yes, there will be. We'll have Dr. McCarthy will be down here, Dr. Shue as well. Will also be here on an intermittent basis. There will have coverage down here on every week at the very least.
Yeah. What kind of services will you provide here?
Down here we'll be providing routine obstetric and gynecologic care. One of the nice things though about this office is the imaging center too.
That's great.
That will be able to evaluate people with imaging at this area. They don't have to drive all the way to the hospital to get those services. And we have a lab in here too.
Well, so will you be able to provide any other procedures or surgical options here?
Here, we'll, as Dr. Bodenheimer said, we'll be serving mostly as routine GYN care, but we will continue to offer our normal procedures that we do at our main office location in Bolivia, as well as the hospital in Bolivia. So.
We talked to Dr. Tillison briefly about minimally invasive procedures at the hospital. Both of you, I assume, do minimally invasive procedures also? Is that
Yes.
correct?
Yep.
And do either of you do the Da Vinci robot?
Both of us do. We both offer robotic hysterectomies, total laparoscopic hysterectomies. We also offer surgical intervention for pelvic floor prolapse.
Yes.
Which is also a really great procedure that allows patients to have a great result. In most cases, be in the hospital one night.
Yeah.
And
Very
go
little
home.
downtime with that. Yeah,
Very
that's made a
little,
huge
yeah.
difference in that procedure.
For sure.
Yeah.
Absolutely. The Da Vinci robotic system is great because there's a time when you would have to have an incision in your belly to get
Right.
a certain size of uterus out or so forth. But with the robotic system, we're able to do all of that laparoscopically. Like Dr. Thompson said, you're usually in the hospital one night and you get to go home the
Right.
next day, and people do well. They require minimal narcotic medication. And it's really
Absolutely.
exciting.
Yeah, absolutely. That's great. Well, for patients who have a question or want to schedule an appointment, how might they do that?
They can call our main office number, which is 721-4050. That would be the best way to go about scheduling an
Great.
appointment.
And they could schedule at any office through
Correct,
that number.
yeah.
Great.
Yeah,
Well, thank you so much for being here today. We appreciate all your time.
Absolutely.
Yeah,
Thanks
thank
for
you
having
very
us.
much.
You're welcome. Vanessa. Jenny, nice to see you. Oh, thanks so much for taking time out of your busy day to show us around your new office. We're really excited here.
Well, we're excited to
see
be
you
here.
today. Well, good. Before we start the tour, let's share a little bit of information about each of you. I know we've all met before, but some of our viewers may not have seen that episode. So let's tell them, for instance, Vanessa, where did you come from?
Well, I came from Charlotte. This was an adventure for me.
Great.
Our children were grown and my mom's in great health, so my husband and I decided to come to the beach, and I'm going to finish working my career here.
Well, great, great. And how about you, Jenny?
Well, I'm originally from New York, from Queens and Long Island, and moved to North Carolina about 11 years ago. Started with Novant about 3 years ago. Prior to that, I was working in Wilmington in an endocrinology office.
Well, good. Well, we're happy to have you guys down here. Now, let's talk a little bit about this new name, because I can't quit calling it the old thing. So the new name is?
Oh boy, it is Novant Family and Internal Medicine, South Brunswick.
Novant Health, Family and Internal Medicine, South Brunswick, right?
That's right.
That
That's
is
a
a mouthful.
That is.
That's a mouthful. Well, now I understand that there's been a little expansion of your services here. It looks huge here. So let's talk about the new providers that are on the way.
Well, we are fortunate that we have a wonderful internal medicine physician coming. That's Dr. Bell.
Great.
And we're going to expand our services to include family medicine, and we have Dr. Stephanie Scott coming in August for that part of our practice.
Wow, that sounds like you're going to have a wonderful team here. I love the incorporation of the family medicine into the internal medicine practice, to have both options available in this end of the county. That's a great
Yeah, I
bonus
think it's
for-
going to be a wonderful thing for the folks who live in this area to be able to access medicine no matter their age.
Yeah. Well, I'm really excited to see the office. So how about let's get started on the tour?
Sure, let's go ahead. Well, this is our check-in right here. When
Yeah.
patients first
So
come
this is the
in.
first thing they see. They come in the front door and they check in right here.
That's right, and then
We have a beautiful lobby.
It is a beautiful lobby. It's so airy and bright.
beautiful paintings to look at while you're waiting, to relax you. And then once the nurses have finished up, you know, setting up all the charting, they'll come pick up the patient here and take them inside. So let's go that way.
All right.
Okay.
Which way?
Now the first stop.
Okay.
The first stop for patients will be this. This is our check-in station. This is where patients get weighed. They may do their pulse oxygen levels. And the nurses will start the charting right there. Then they'll escort them to an exam room down the hall. And we can take a look at this exam room if you
This
like.
is a great example.
Oh, this is nice. Like the window. And, yeah, I'm sorry, I'm standing in front of you. This is nice.
We have all our equipment in here. Everything's set up. It's locked.
As they
They're all
should
locked,
be.
as they should be. So each clinician, each clinician is set up to do everything they need to do right from here. They don't have to go back outside to get anything.
And one thing I like too is in this setup, the clinician is sitting at the computer. You have an opportunity to face your patient, and we have room in this office for the patient's family member or significant other to join in the visit. That's good.
That is nice, because I've heard patients say he or she doesn't look at me anymore because you know you're looking at the screen, and so that's really important that you make that connection, that eye connection with your patients.
And we can turn this around
Sure,
to
and show the
completely
patient.
involve the patient in the electronic part of their visit as well.
Great.
So that's good.
Okay. Okay, lead the way.
Well, this is one of our nurses' stations, and here are two of our
Who
nurses.
are these lovely young ladies?
This is Stephanie Taylor. She is an LPN with us. And this is Stephanie Mayers, who is one of our MAs.
Could you make it any harder? Two Stephanies. Okay.
There were three. We've made
There
it
were
easier.
three. Oh, we're
Exactly.
making progress. Well, hey, ladies, it's nice to see you. Nice to meet you. Good. We're excited to have you guys here. Good, good. I know that the patients are going to love this space. It's really, really nice. So, welcome. Thank you, thank you. Let's talk a little bit about the services that are offered here. What all do we have? What all?
Well, we have our own laboratory. And as of this week, radiology moved into the space next door. So now we no longer have to refer patients down to the hospital or to Sunset Beach. They can walk out one door and into another to have x-rays or MRIs scheduled, which is a great service for our patients. It's so much easier for them.
We do mammograms locally, and we're going to be having that mobile MRI machine come, and so that will really be a good thing.
Yeah, I think it's going to be here one day a month.
Yes.
On,
Yeah, once or twice.
Thursday,
To begin.
and then mobile MRI will be here on a Wednesday, I believe. Well, that's great. And is that out back? Is that behind the building?
It is.
Yes,
There's
yeah,
a
there's
pad
a
back
pad
there.
back there.
Okay, wonderful, wonderful.
Other services, we have some partners that are joining us in this space. We have OBGYN, and we have our surgical partners joining us. That's just started, so we're very excited about that. And we really hope to expand those services and maybe bring other specialists to this area.
And that's kind of on the other side of the building, correct? These are kind of like mirror spaces. So they won't be in here where you all are. They'll have plenty of space. Have their own spaces. So that's really
That's
nice.
right, yes.
That's
And OBGYN and surgery have already started with this. Urology is expected to begin coming to the office in May.
Oh, wow. That'll be great.
We're expanding quickly.
And none of those offices are closing in the other areas. This
No.
is just in addition to all their other
Correct.
practices,
Yeah.
correct?
There's just so much growth in this part of the
In this
county,
part of the county.
that you know we're just going to expand and accommodate.
Yeah.
Did you want to look at the procedure
Sure,
room?
let's
This
look
is
at
one of the rooms
procedure
that we
room.
use.
What do we do in a procedure room?
We can do a lot of things in procedure rooms. We can do joint injections. We can do what we call an IND, which is incision and drainage of somebody that has, an abscess on the skin. There are a number of minor surgical procedures that we can do in here.
We have cryotherapy services for freezing off lesions.
Oh, you can do that.
We do that here. Certain lesions respond better to electrocautery, and we have that ability too. But nice, fresh space.
It is. It's so clean. It smells like a new car. It's great in here. Okay, so what's up next?
I guess the lab.
Great, let's go. So tell me about the lab here. What do we do in the lab? What services, and do you have to send anything out?
Well, we do. This is basically a drawing station for us. I mean, there are a few things that we do in-house, but the main value for this facility is that we can draw blood and send it to our lab partners for processing, and we get a quick turnaround. We have results of most tests within 24 hours, and then again, we can release those to MyChart, and the patient gets a chance to take a look at them. If they're coming in, they get a chance to look at them, digest the whole scenario, and get their questions ready for when they come in for the visit. And sometimes it's just, we can send a note along saying, your lab is good, everything is fine, we don't need to do anything different. But this is a huge expansion. We have a facility here for 2 people to draw blood in this lab, so I think that's going to be good. I think we're going to be able to accommodate
Well, I think in an
growth.
office this size with as many providers as you all are going to have, I think it's good to have at least 2 drawing stations. Then there's no wait, and better for the patients.
Yeah.
So it's a real pleaser for patients. Yeah, well, great. Well, if someone is watching our show and they would like to make an appointment, how might they do that?
Well, they can call 910-579-8363. That's our telephone number. It's still the same.
Still the same.
In case anybody remembers our old number, it's still the same. If you're a patient and already a patient of ours, you can actually schedule appointments online through MyChart as well. And we're taking new patients.
You are taking new patients. That's what I want to know.
Yeah, we are taking new patients.
Yeah, that's great. And as soon as the other 2 providers come, I'm sure you'll be taking many more new patients, right?
Yes.
Right.
Yeah.
And I'm going to say this about Jenny. Jenny's time in endocrinology has made her quite an expert in managing.
I've actually heard that.
Yes. She's very good at managing problem diabetic cases, thyroid cases, things like that. She often sees patients for providers in other offices. So some of the patients have their primary care services provided somewhere else, but come to Jenny to get their thyroid.
I didn't know that was an option.
Yes, that is an
That
option.
is an option.
I see patients not only from other Novant physicians, but from outside practices. I'll get referrals from those.
From an
those.
independent physicians.
Correct.
Great. Well, that's awesome. So they can just call and inquire and see what's available and make an
That's right.
appointment. Great. Well, thank you both so much for
Thank you, Jen.
having us today. You're gracious, and we're just pleased to have you here in this new space. And I know you're going to be very, very successful. So
Thank you.
Thank you so
thanks
much.
again.
Thanks for coming.
You're welcome. As we wrap up today's show, we have one final guest who's here to talk about a special event. It's Cindy Cheatham. Welcome, Cindy.
Thank you.
Welcome
Thank
to the
you.
show today. So, for our viewers out there who may not know what your role is at Novant Health, tell them what your role is, please.
I'm on the foundation at Novant, and I serve as the vice chair currently.
That's great, and you help a lot.
I love
You're
it.
very, very helpful.
I love the health industry, and I love Novant.
Yeah. So the flip-flop ball is coming up, right?
Yes.
So let's start with the basics. When
Okay.
and where?
It's going to be Friday, May the 20th at
Right.
Brick Landing from 7 until 11 o'clock at night.
So it's a little bit longer this time. than
It's a
usual.
little, yes, it's a little bit longer. Cocktails start at 7, and at 7:45 they'll start the dinner and dancing.
Good. So when they get there, there'll be cocktails ready. Is that right?
Absolutely,
Okay,
absolutely.
Great. Well, how much are the tickets this year, and how would our viewers go about getting those tickets?
Well, our tickets are the same as they were last year, which is $100 a person. And you can buy the tickets by calling the hospital directly and asking for Victoria Bellamy, or you can go on the website for Novant.
Okay, they were available there last year, so I'm sure
Absolutely.
that'll be easy to find. Could you share a little bit about what the funds will be used for? The funds that come from the flip-flop ball. What were those? Will those funds go
Okay,
toward?
well, there's several needs that the foundation supports. This year, they're just going to the Greatest Need Fund, and that can cover just really lots of different needs that the patients and the families and the
Well, that's great.
staff have.
And then the foundation board, I assume, would weigh the options and see where
Absolutely.
it needs to be, where the funds need to go.
Absolutely, but the wonderful thing is it stays right here in our county.
Exactly, it stays right in Brunswick
Mm-hmm.
County. Well, I know that we're certainly looking forward to the flip-flop ball. Can you share any information on the foundation's other events this year? I know there's a couple more.
There is a
Aren't you having a golf tournament?
Yes, there's a golf tournament in September, and then there's Glitz, Glamour, and Glow for the ladies that takes place in November, I believe.
I think it's usually the first weekend in November, but I think it's going to be a little bit earlier this year.
Oh,
I heard
that'd be
like
perfect.
the last Saturday in October. I think
Yes,
that's
get some
yeah.
Christmas shopping done a little early.
Absolutely. Well, thank you so much for being here today.
Thank
I
you.
know that everybody's out there is looking forward to that event. That's a beautiful venue, Brick Landing. They
It
always
is.
do such a phenomenal job.
It is.
And the view is
Wonderful
amazing.
view, wonderful food. The Imitations will be providing our entertainment.
Again? Oh, that's
again.
great.
So,
They're great.
so they are so entertaining. Absolutely.
are very
So whether you dance or not, you're going to have a good time.
Yeah. Well, thanks again, Cindy. I hope to see you soon.
Thank you.
Thank you so much for joining us today at our new South Brunswick Medical Plaza in Carolina Shores. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
Stay connected with your community channel. Like ATMC TV on Facebook today.